Hey there friends, I'm Abhijeet, still a final year medical student from GMC Nagpur. I am done with my practicals. My last practical, that is OBGY, was yesterday, and here I am to tell you about all the experiences, bitter and sweet, that I had during this practical exam. If you are a medical student, this video will help you get an insight about how to prepare for your practicals, and if you are a non-medico, keep watching because you will be glad that you did not take MBBS. Let's get started. My theory exams were done quite a while ago, and I was lucky enough to get around 10 to 15 days to prepare for my practical exams. My first practical was on 20th February, and that was pediatrics. Now, in pediatrics, you need to make sure that you have a kit to examine the patients, and this is the kit. First of all, of course, you need to have an ID card with your university roll number on it so that you are recognized as you. Then there comes this little box. Now, this box has sugar, salt, camphor, coffee. No, I'm not going to make coffee in the exam. Of course, it is for examination of the taste and smell and sight and hearing, etc. of the patient. As I mentioned about hearing, we need to have this tuning fork. Preferably, you should have two tuning fork, one of 128 Hz and one of 512 Hz. The 512 Hz one is used to do auditory examination, that is Rene's test, Weber's test and ABC test. Then there comes our very own torch. This torch is used for examination of oral cavity, eyes and other things. Then comes this hammer. This hammer is called knee jerk hammer or knee hammer. There are other names to this hammer, so make sure you know all of them. It is used to elicit reflexes like knee jerk. I'm pretty sure you have seen doctors just going and hammering different joints of the patient and doing some stuff. So this is for the reflexes that you need to do. Then there is sanitizer to make sure your hands are clean before, during and after the examination of the patient. I brought two of them just in case. I have no idea why. Then there is the measuring tape. In pediatrics, you need to measure a lot of parameters like upper limb segment, lower limb segment, the ratio, the mid-arm circumference, etc. So this measuring tape is very important for that. I keep a marker with me just in case I mess up with this university roll number, or I need to mark something on the chest of the patient like the apical impulse or any mass that is present in the abdomen. So this marker is also important. This is a pervert marker. Please don't get a pervert marker. I was scolded for this. Please just keep it aside. Of course, the pen to write, practical book to submit, and your notes to read. So that's pretty much all the kit that you need for the practical exams. Now let's dive into the practicals proper. My first practical was pediatrics, and that was 7:30 a.m. in the morning on 20th February. I barely had any sleep the last night because syllabus itna bada hota hai. I had to stay awake for till 3 o'clock or 4 o'clock or something, and then I had to get up at 7 o'clock. About the books, I read Santosh Kumar Practical Exam Manual for pediatrics. Then I read my own notes. I read Ghai, and I think that is pretty much all that I read. Then other things like the photos that my seniors and friends provided, the PDFs, the White Army videos. The other supplementary material is very subjective, but these three things, that is practical book, Ghai and your own pediatrics notes, are very important, and like that is all I did the last night. Next morning 7:30, sleepy head, very tense because I came to know that very strict sir was going to take our viva, and I am not very good with strict vivas. Now cases are divided based on the system to be examined. So there is cases of respiratory system, central nervous system, cardiovascular system. You get the idea, right? So I was very good with cases of central nervous system, and I did read respiratory system a bit, but I was not very good at it. I was weakest in cardiovascular system, and I did not know much about it. So I went there at 7:30. What happens is they put chits on the table and you need to lift the chit. Whatever the number you get, you are assigned to that bed, and that is your case. So for me, as you might have guessed, with my luck, my case was of CVS, the one thing that I was very weak at. क्या कर सकते हैं, फाइनल ईयर वाइवा है, करना तो पड़ेगा. So I started with that. I asked the patient about the history, his clinical presentation and complaints, the past history, any other systemic history, the examination. You need to make sure that you can do all the examination on the patient and you can perform the same thing in front of the examiner as well. क्योंकि कभी कभी यार anxiety हो जाती है, तो सादा सा नीजर भी करते नहीं आता. So that is something you need to avoid, and for that you need to do a lot of practice. So I'm not exaggerating when I say that the months that you spend in postings are very important. In postings, we were given the cases, we took the history, we did the examination. So it was a natural habit for me and a lot of my friends. For those who could not attend those postings, it was a nightmare of an exam. So let's keep that aside. So my case was of CVS, and there was history of sore throat. भाई गला खराब तो सबका होता है. Even now I have a sore throat. So I thought it's not that significant. Then when I did the examination, I heard, oh no, pansystolic murmur in the mitral area, pansystolic murmur in the tricuspid area, and a mid-diastolic murmur as well. Dear God, this person had rheumatic heart disease. And of course, he had complaints of chest and joint pain. So I thought it's a surefire diagnosis. इस पे तो कुछ नहीं होगा. तो मन को शांति मिली थोड़ी सी. Even now, remembering that moment, I get anxious. So I was standing there at case number 16, waiting for my viva. The strict sir was coming one by one, taking viva of the other classmates and scolding them quite a lot. I was so scared that my legs were trembling, but I guess that was because I was standing from 3 to 4 hours and I am not used to this much of physical stress, especially when I did not sleep much last night. So the strict sir was here in front of me. I was ready with my case. I started reading the case. Mr. ABC, blah blah year old person with chief complaints of blah blah. The format that I was using was from Santosh Kumar itself, so I was sure कि format पे तो नहीं डांटेंगे. Then after reading the chief complaints itself, he asked me the question, what do you think is the probable diagnosis of the patient? Yes, यही question तो मुझे आता है. And I jumped straight on the diagnosis saying, sir, this person has fever, has had history of sore throat, has joint pain, and he has some cardiovascular symptoms as well. So this has to be a case of rheumatic heart disease. Okay, all good. Sir, ka next question. What other things can happen with the same symptoms? Like, what are the differential diagnoses that you have? Oh dear God. ये तो मैंने सोचा ही नहीं. Mind blank. My legs trembling. हाथ थर थर काँप रहे थे यार. So all I could say was, sir, it may be other cardiovascular diseases, and then it clicked. Infective endocarditis में भी तो ये हो सकता है because of septic emboli. Then I said that, and sir had a very disappointed look. पक्का गलत बोल दिया मैंने कुछ ना कुछ. But ठीक है, sir considered it and asked me to read further ahead. Then I told the history, did the examination and told them about the investigations and treatment. In the end, the sir said कि तुझे पढ़ना पड़ेगा. So I don't think that viva went well. ट्रॉमा तो हो गया था, एंड आई मीन मेंटल ट्रॉमा. वाइवा तो ठीक ठाक गया. आई वॉज श्योर दैट कुछ नहीं तो पास तो पक्का हो जाएंगे. सो आई चीयर्ड माई सेल्फ अप. You cannot talk to anyone else in the whole hall in the viva. The only person you can talk to is the examiner and the patient, and of course yourself. So cheering myself up, I got ready for the second thing, that was the short case. In short case, guess what I had? मैंने नियोनेट पढ़ा था बहुत अच्छे से. आई डिड CNS परफेक्टली. आई वॉज सो श्योर दैट आई कैन गेट एब्डोमेन एज वेल. ऑब्स्ट्रक्टिव जॉन्डिस के केसेस तो बहुत सारे होते हैं. इवन नियोनेटल जॉन्डिस इज देयर, बट आई गॉट ब्रोंको निमोनिया, द सेकेंड वर्स्ट सिस्टम दैट आई कैन गेट. द पेशेंट हैड अ हिस्ट्री ऑफ 25 days of fever and cough. And I said that this person has bronchopneumonia, and pneumonia does not have this long history. So my viva got sidetracked then and there itself. It roamed from cardiovascular system to tuberculosis, and he asked me all sorts of questions about it, and I was answering them just on the previous memory. That is the part that I studied during prelims and during my university exams. ठीक है, कुछ आया कुछ नहीं आया. I made a lot of fumbles and mistakes, but in the end, all's well that ends well. So that was the short case. The last question was that he asked me about the dosing and regimen of antitubercular drugs. I tried to tell as accurately as possible, but well, I made a lot of mistakes. So, khatam ho gaya. Long case gone, short case gone. The third thing in pediatrics is the table viva, means instruments, X-rays, and stuff like that. The X-ray that I was given was of egg on side appearance, that is TGA. In that X-ray, I started with, this is a plain X-ray of chest, a posterior anterior view, showing central trachea, etc. The same format that was given in Bolor internal medicine. But sir said, यार ये सब मत बता, सीधा positive findings and diagnosis बता. I was kind of shocked. It took me aback, so I stayed silent for 10 seconds. भाई पहला प्रैक्टिकल है, कुछ खाया नहीं है सुबह से, तो एंग्जाइटी तो होगी. But then I said TGA and sir was happy. Afterwards, the whole viva went towards cyanotic or cyanotic heart disease and cardiovascular system. यार ये एक ही सिस्टम नहीं पढ़ी और यही क्यों पूछ रहे हैं? That's what my thought was in that exam. But ठीक है, all went well. Afterwards, he gave me a drug, potassium chloride. I tried to answer as much as possible. And lastly, he gave me vaccine, that was DPT. And that's how my pediatrics viva ended. It was around 2 or 3 o'clock when I went back to my room. I was so exhausted that I barely had any energy to eat in the first place. But कैसे कैसे खाना खा के बेड पे सो गया. After 4 hours of peaceful sleep, I woke up. Actually, the anxiety of the next paper woke me up, and that was medicine. ये ऐसे back to back dangerous exams रखने का idea किसका है? Why not give students a bit of gap, a little holiday? Why do you want to torture students like this? Keeping those things aside, I started reading, and I started with CVS क्योंकि pediatrics में तो पूरी लग गई थी. I don't want the same thing to happen in medicine. In cardiovascular system, I read all about pulses, murmurs, or BP, everything that you can find out, examination, etc. etc. ठीक है, completely ready. The second thing I was sure was कि इस बार तो पक्का CNS का केस आएगा, because CNS is one of the favorite systems that I want to do, and the localization of stroke and examination of nose is something I have very much fun in doing. And of course, in postings I took a lot of CNS cases. भाई 20-30 तो पक्का लिए होंगे, तो I was very confident in it. तो CNS हो गया, RS भी कर लिया, and abdomen. So I was prepared and ready with medicine by 3 o'clock. It was not a smooth night. I had anxiety and palpitations, so I went out to roam a bit. होता है यार. No matter how much you read, this kind of things happen. So you need to be strong physically as well as mentally if you want to at least stand your footing in these viva and exams. So 3 बजे सोया. Again the practical was at 7:30 a.m. उठ गया कैसे भी करके. Very sleepy, I could barely keep my eyes open, and I went there for medicine. Guess what I was given? Just a minute. The chit that I got was L16, S22, S2. I know these numbers don't mean anything right now, and same for me. हो गया यार कुछ cases, कर लेंगे, पढ़ा तो बहुत है, and CNS तो आना ही है, बहुत सारे cases CNS के. So I went there, L16. Hello sir, I am Abhijeet Raghatate. I am a medical student and I want to take your history and do your clinical examinations. Okay. आपका नाम ठीक है, XYZ. Blah blah. Demographic history done. So क्या तकलीफ है आपको? History of breathlessness on exertion. There you have it. Another case of CVS. I thought, oh no, फिर से नहीं. Then I kept on prodding and asked, ठीक है, do you have paroxysmal nocturnal dyspnea? Do you have orthopnea, platypnea, etc.? The patient said no. Okay. Breathlessness है, but ये सब नहीं है. Do you have cough? Do you have hemoptysis? Do you have any kind of evening rise in temperature? Any kind of pain in the chest? Nope, not at all. but ये केस है किसकी? Then on examination, this helped. हाँ, आप थोड़ी आँख नीचे कीजिए, नीचे पैर की तरफ देखिए. Pallor, severe pallor. Pallor on the palms and soles and pallor in the eyes and mucosa. This was a case of severe anemia. Hematology? This is unexpected. I mean, there were cases of hematology during my postings, but I never thought I'd get one. ठीक है. It's still blood. It's still nutrition anemia. I can do it. Confidently, I took the history. All systems normal. ठीक है. Present कर लेंगे. Probable diagnosis तो दे ही सकता है. So the examiner came. हाँ बेटा, start. Demographic history. So this is XYZ, blah 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 blah. Breathlessness or exertion, pain, etc. etc. So tell me, what is orthopnea and what is platypnea? What, sir? Oh, who am I kidding? I could not even utter what, sir. I was frozen. कल ही तो पढ़ा था, याद क्यों नहीं आ रहा? It hasn't even been 12 hours. Orthopnea, platypnea, something related to standing and sleeping. Come on, brain, do something. Breathlessness started. Sir saw it and sir said, तुझे खुद को anxiety और breathlessness हो रही है क्या? And I was like, sir, please. So I closed my eyes for 30 seconds, deep breathing, got myself in control, calmed down, and then started. Sir, orthopnea is patient feels better on standing, platypnea is patient feels better on sleeping, and these are the differential diagnosis of orthopnea and platypnea. This is the mechanism. And from then onwards, the viva picked up. I was very happy that I could answer all the questions on the basis of pathology that I read in second year. Afterwards, my viva ended on dosing of iron supplementations and the types of them, and I was happy. बट आई स्टिल वॉज डाउटफुल कि यार स्टार्टिंग में तो मैंने गफला कर दिया, शांत रहना नहीं चाहिए था. ही नोज दैट आई वॉज एंशियस, विल ही फेल मी? देन अगेन माई सेल्फ टू माई रेस्क्यू, आई सेड कुछ नहीं, होता है, चलता है, आगे का देखते हैं. तो माई नेक्स्ट केस, S2, an old lady, again panhystolic murmur, again mid-diastolic murmur. This is rheumatic heart disease. I was given the same case yesterday and today I am prepared for it like hell. So sir came, directly asked me the final diagnosis. In short case, you don't really need to tell the whole case, you just need to tell the positive findings and the final diagnosis. And he asked me, what are the differential diagnoses? Sir, this time I am ready. So these are the positive findings, this is the final diagnosis, but there are this differential diagnosis. Yes. What is the grading of systolic and diastolic pressure? Sir, ये है. What is the grading of murmurs? Sir, there are two different gradings of systolic murmurs and diastolic murmurs. Blah 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 blah. And the viva ended on the treatment. I was ready with actual diameters and the treatment related to it, and yes, ये वो एक वाइवा तो मैंने फोड़ दिया. I was very happy with it, and that confidence pushed me towards the third case. That third case was S22, the ending case. And guess what she had? Breathlessness, pain in limbs, and recurrent infections. This seems like some kind of triad. कहाँ पे पढ़ा था मैंने ये? Triad, breathlessness, some kind of anemia, infections, bone marrow. Oh dear God, she has chronic myeloid leukemia, some kind of bone marrow neoplasia. Oh God, ये तो पढ़ा ही नहीं. I know, it was important. It was one of the important cases, but you cannot read everything the night before, ना. It's alright. You have second year's knowledge. थोड़ा सा तो याद आएगा. Sir came. Sir asked me about the case. I told him CML हो सकता है sir. Probable diagnosis. Sir का first question. Elicit sternal tenderness. I have not read about this ever in the 4 years of my life. There are things that get skipped automatically, and this was one of them. I sort of thought कि ठीक है भाई, sternum है, tenderness elicit करनी है. Patient lie down, thumb pressing on the sternum. Sir, is this? And I looked at the examiner. Wrong. हार्ट अटैक ना आ जाए. ठीक है, इट्स राइट सर, आगे भी है, वाइवा खत्म नहीं हुआ है. तो अब examiners usually keep a timer with them, like around 5 minutes or so, I don't know. And the viva goes on until that timer tings. So if you don't know the answer, just say that you don't know and get the next question ahead. So I said, sir, I don't know the answer. The next question about CML, the positive findings. Then the viva went somehow to the hepatocellular carcinoma, then liver failure, signs of liver failure, and ended in what it means to have fetal hepaticus. थोड़ा सा फंबल किया, but all viva went good. All good, medicine khatam. Not khatam, there were 4 table vivas left. First was X-ray, and my X-ray was that of pleural effusion. Sir asked a trick question. Is this an X-ray of a male or a female? My blind self did not read the name on the X-ray itself, and I said this X-ray is of male. Big blunder. Then sir showed me, देख नाम देख, look at the artifacts in this X-ray. It is definitely a female X-ray. ठीक है. Diagnose the X-ray. I said, sir, it is definitely pleural effusion. He said both the recesses are filled up. There is cloudiness in the lungs, haziness in the lungs, etc., etc. ठीक है. The viva went well, but the sir was a bit disappointed that I could not even read the name on the X-ray. ठीक है, होता है. The next one was that of case. ALT elevated, AST elevated, conjugated bilirubin elevated. Definitely a case of obstructive jaundice. All well. Then ECG. I could not identify the ECG. It was probably ventricular tachyarrhythmia, tachycardia or something. But I was too scared to even open my mouth. So I was like, it is probably ventricular tachycardia. And sir was like, okay, good, go. Tukka lag gaya. I did revise X-rays on the last night, but I am not perfect in X-rays. I admit it. Okay, it's very hard for me. And this is a topic that I will revise in the upcoming holidays that I have. Okay, 2 done, 2 left. Next one, he gave me all the IV cannulas, asked me about the gorgeous. Anuj ने trick पढ़ाई थी, answer कर दिया. Then he asked me about Foley's catheter, answer कर दिया. And lastly, the viva went on drugs, anti-tubercular drugs. अरे सर, कल भी तो यही पूछा था मुझे pediatrics में. This time, I gave the perfect answers to everything. The next drug he gave was sodium valproate. Oh shit. ये तो नहीं पढ़ा है sir. I said sorry. I know this is an anti-epileptic drug. It's broad-spectrum anti-epileptic drug used in this. I don't know the dosing of the drug. The whole thing lasted till 4 p.m. in the afternoon. Think about it, from 7:30 till 4 o'clock. Completely exhausted again. I went back to my room, ate something, and slept. Best thing ever about medicine was the next day was holiday. OBGY के लिए बहुत time था. So I read all the notes from dams that I made. I did not read Datta because I particularly don't like that book, and I hope that this notes and the practical book in itself was enough. Okay, ready tha. But it still took me like 3 o'clock at night next day to finish it. And again, with just 4 hours of sleep, 7:30 in the morning, ready in the Viva. Cases. First case was allotted. ठीक है. What problem do you have, ma'am? ब्लड शुगर बढ़ा है. ठीक है. So it can be a case of gestational diabetes mellitus. मुझे बीपी भी है. ओके. प्री एक्लैम्पशिया. प्रीवियस सीजरियन सेक्शन भी. ओ गॉड. प्रीवियस सीजरियन सेक्शन 2. Symphysis fundal height is small. IUGR. लिक्वर तो पाल्पेट नहीं हो रहा है उतना. Oliguria. The case was a full house obstetric case with GDM, pre-eclampsia, IUGR, previous cesarean section and oliguria. Amazing, Abhijeet. Superb luck you have. The next case that I had was gynecology, pelvic organ prolapse. Okay, ये तो सबसे अच्छे से आता है because this is the case that I took in prelims. This is the case that I took in the post-end exam as well. So best ever. And I was ready for the viva. The first viva was that of gynecology because I come in the end part of the batch and ending से gynecology शुरू हुआ था. In gynecology, ma'am was sitting in front of me. I was there. She said, ठीक है, case पढ़ो, diagnosis बताओ. So, ma'am, pelvic organ prolapse. How will you treat this patient? Ma'am, total abdominal hysterectomy. 29-year-old patient and you will do total abdominal hysterectomy? काही सूदबूद आहे का तुला? I was like, oh no. I gave the most general answer that I read and it was wrong. So I remembered. I took 20 seconds at least just silently looking at my feet and trying to remember and it clicked. Ma'am, Manchester of father gets repair. उसका यूट्रो सर्वाइकल लेंथ बढ़ा है क्या? है क्या? Sorry ma'am, no ma'am, sorry ma'am. Shit, second blunder दे दिया. Now what? Then again I thought and then ma'am prompted. Sling सुना है? Sling. Ma'am, anterior posterior slings surgery, Sirotka slings, खन्ना sling, etc. And ma'am was like, ठीक है. आगे से ध्यान रखना, don't make such blunders. It's alright, okay. Then she asked a bit more about the case, its complications, stress urinary incontinence and stuff, and that was over. In instruments, I was given a brush. It was plastic brush with bristles in the end. Endocervical brush to tha, but I doubtfully said, I think this is endocervical brush. What are the uses of it? I said, diagnosing, taking samples for diagnosing carcinoma, pap stain, etc. The viva from there went from pap staining to HPV to vaccination, and it ended at the dosage of those vaccines. But good thing is, OBGY is one of the subjects that I'm very good in. So, मैंने बता दिया. In the end, ma'am asked me my name and I was like, yes, ma'am, Abhijeet Raghatate. Thank you. Very good viva. I was like, okay. एक तो अच्छा गया at least 3 दिन में. Yes. And I was happy. Went back to the side room and waiting for the next viva. Obstetrics viva bacha tha, and I was one of the last roll numbers for it. So it took me like 3 o'clock for obstetrics viva, and by that time I was very exhausted, hypoglycemic, tired, sleepy, everything that you can imagine. And my case was a full house. So I went there, told sir that this is the case. Total diagnosis. The sir and ma'am, internal external, asked me about previous LSCS, its VBAC, its indications, contraindications, methods to prepare, etc. And my viva ended at scar and its tenderness. Okay, all good. Obstetrics and gynecology were good, and I'm happy about it. Now the one left is surgery. Now thing about surgery is that my surgery exam hasn't. Now thing about surgery is that my surgery practical exam isn't over yet. It is supposed to be around 8 March. So we have time. चलो गोवा घूम के आते हैं. Quite literally. So my next vlog will most likely be about me chilling in Goa and worrying a bit about surgery exams. This is Abhijeet signing out. Bye bye. I hope you had fun hearing about it.